Welcome to Shakil Health Society. Today, I, Dr. Shakil Ahmed, will present osteoporosis. What is osteoporosis? Osteoporosis is a combination of two words, osteo for bones and porosis for porous. Osteoporosis occurs when there is high bone breakdown and low formation of new bone. It causes low bone density that weakens bones and is a risk of bones fractures. It develops without any symptoms or pain, usually discovered with painful fractures. Prior to discuss the details of osteoporosis, a few points about bone structure. Each bone has two parts. One is compact bone. This is hard outer layer that is dense, strong and durable. It makes up around 80% of adult bone mass. The second part is cancellous, also called trabecular spongy bone. This consists of a network of trabeculae or rod-like structures. It is lighter, less dense, and more flexible as compared to the compact bone. Osteons are fundamental unit of cortical bone, having cylindrical structure, and it contains Haversian canal, which is a canal in itself, contains the nerve and vessels, including artery and veins. Lamellae, layers of compact matrix around the Haversian canal, and lamellae are made of organic fibers like collagen and inorganic material such as hydroxyapatite, which contains calcium phosphate. Lacunae, these are containing the osteocytes. In this image, this is a long bone. This part, which is outer, that is compact bone. The spongy bone is lying here. The yellow part shows the marrow. As it is explained, the compact bone unit is osteon. In this osteon, as explained, has Haversian canal. The nerve, the artery and the veins are inside this Haversian canal. The lamellae are here and trabeculae are present. The osteocytes are also lying here. Bone replacement. It is a physiological process that each bone with a certain period of time will replace. The spongy bones replace every 3 to 4 years, while the compact bone that is replaced every 10 years. Bone remodeling. Bone is always being remodeled. Remodeling itself is a two-part process. One is resorption and the second is formation. When osteoclasts break down and remove the bone, this is called resorption. While when the new bone is laid down, this is called the formation. Approximately 10% of adult skeleton is replaced each year. Remodeling allows the body to fix damaged section, reshape the skeleton during growth, and regulate calcium levels. Remodeling is a process which is under the control of several hormones, including parathyroid hormone secreted by parathyroid gland, calcitonin secreted by the thyroid gland, vitamin D, estrogen in females, and testosterone in males. Role of PTH and calcitonin. Whenever there is low serum calcium, the parathyroid gland will secrete parathyroid hormone. So the level of parathyroid hormone is increased in the blood, and it will cause increased bone resorption. And the process of resorption will increase the level of the calcium in the blood. In this diagram, here the serum calcium is shown as low. It will stimulate the parathyroid gland. It will secrete the PTH, and the PTH will process the resorption, and due to this resorption, the calcium will move from the bone to the blood, and the serum level of calcium will be balanced. Calcitonin is secreted in response of high serum calcium by the thyroid gland. The calcitonin will increase the bone formation process. So the high level of serum calcium will be utilized in bone formation. So the level of the serum calcium will be balanced. In this diagram, whenever the serum calcium level is high, that's the thyroid gland, calcitonin is secreted, and the calcitonin is increasing the bone formation process, and the level of the calcium will be dropped and will be balanced. The role of vitamin D. Vitamin D enhances the absorption of dietary calcium by 30 to 40% in the gut and maintains blood calcium level. Vitamin D insufficiency leads to secondary hyperparathyroidism that causes increased bone loss, osteopenia, osteomalacia, osteoporosis, and increased fracture risk. Risk factors. One is low estrogen, especially in postmenopausal women. Low serum calcium, excess consumption of alcohol or smoking, drugs such as glucocorticoids, heparin, and tyrosine, physical inactivity, so the body or the bones are not ready to take the stresses. Some syndromes like Turner, Klinefelter, Cushing syndromes, diabetes, and hyperprolactemia. The osteoporosis are divided to two types. One is postmenopausal, especially that occurs due to low estrogen and that causes increased resorption. The second type is senile, in which the osteoblasts lose its ability to form new bone, and osteoclasts are dominated. The symptoms of osteoporosis. There is no symptoms till fracture. In the common sites for fractures are vertebrae, especially compression fractures, femoral neck, and distal radius or wrist. Diagnosis. DEXA scan for bone density is used. In DEXA, there is comparison of individual bone density with normal adults' bone. There is a scoring system, and whenever the score is less or equal to -2.5, it is clearly diagnostic for osteoporosis. Treatment. Multiple options are available. First of all, the bisphosphonate, including alendronate and rizidoronate. The second drug is the teriparatide. This is a recombinant PTH and activates the osteoblasts. The third drug is a thiazide diuretic, which causes retention of calcium in the kidney. Denosumab, this is basically monoclonal antibody, activates the osteoblasts. And raloxifene saturates estrogen receptor modulation. Thank you very much for watching. I tried to explain the osteoporosis in a very simple and avoiding too much details.